we're going to have increase in the number of facilities that we would visit in the year 2025 by 30%, that would have improved compliance and enhancement of data-driven decision-making using data analytics, that we're going to strengthen collaboration between our partners, and we're going to have 25% increase in our compliance rates by carrying out the key strategies. We want to expand our monitoring coverage. We want to enhance our digital infrastructure by integrating a secure online pathway. We also want to include the e-learning platform and our mobile platforms on the digital infrastructure. We want to strengthen our community engagement and build capacity of both the farmer staff and our partners. We want to drive innovation and research. This year, we want to carry out research on quality of care. In doing all of this, we want to make the health facilities in Lagos safer by leveraging on technology and ensuring that all our processes are data-driven. Thank you very much.
Thank you very much, Dr. Onoriede, Dr. Nibo Shinawo, Dr. Veronica Iwayemi, and Dr. Abiola Idowu. Your Excellency, the Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu, the Honorable Minister of State for Health, Dr. Isiaq Salako. Taking us further in the comparative study, I want to especially welcome a professor and consultant medical parasitologist at the College of Medicine, University of Lagos. He coordinates the International Malaria Microscopy RDT Quality Assurance Center, as well as the country's World Health Organization malaria specimen collection sites in the College of Medicine, University of Lagos. Ladies and gentlemen, please let's put hands together for Professor Wellington Oyibo for the very short comparative study. Thank you very much.
Thank you very much, His Excellency, Executive Governor of Lagos State, the Honorable Minister of Health, here represented here by the Minister of State for Health. Ladies and gentlemen, first of all, this is historic for us. This is a path we have planned, prayed for, and we are happy that this is happening. Mr. Governor, thank you for all you and for making this happen myself. I'm so happy and grateful to the Honorable Commissioner of Health. He has told the story. So I'm going to build on those stories as I make this presentation. I don't have much time. And part of the whole thing is the advances that Lagos State has made for over 2 decades. The world is hearing it, and the distinct nature of this project through the impact project itself, which is calibrated around the impacts that this project will be again for Lagos State. My slide, please. So what we know about malaria, in the 15th century, why was it called malaria? It was called malaria because the cause of that fever illness was not known. And it was connected to marshy waters. So malaria in Greek is foul. And that was all they could do. And it took some another 100 years before it was connected to mosquito bites. And today we are talking about fever and say all fevers are malaria. So are we going to the 15th century? And this is what we're trying to really unbundle in Lagos as it's still over 2 million people. My slides. So if fever is still malaria, we go back to the 15th century. And then, of course, for evidence base, meant that we will have to quickly provide the evidence. Can I have the slide up? Yes. So the horrible complaint of school is out from here. So, I've given this background. Most health workers with do not accept the test results when it's negative. And that's the challenge. Next slide, please. Okay, and if you don't have data, which we are talking about digitization, you cannot calibrate where you are. And so if we look at the entire program and the plan of the projects, is to see that real-time data is available and that tests are done. And when the test is done, we can say quickly, cost-effectively, this is where we are. Because you can rely on routine data. The country do not have quality data, and that's the challenge. Next slide. So low confidence in the test. Basic things are being used. Lagos is making progress. How do we handle this? 94 to 96% of the reporting for malaria in the DHIS that categorizes states and Nigeria comes from the primary healthcare sector, and this from the public sector. It's important to recognize this. Next slide. And we're bringing this on board because we provide the quality platform for quality diagnosis at the College of Medicine. Next slide. And we do all of this carefully to ensure that these tests are good to be used for humans. Next slide. And what is done? Please just keep on going on the slide because I'll just go through them. There are changes in Nigeria in terms of malaria epidemiology. Next slide. And then we see from the 2021 malaria indicator survey where Lagos is. Next slide. And you can see where we are here at 2.6%. Hopeful. And next slide. Good progress. And we're talking about the path for pre-elimination. We have that path. And we are happy that this is being mentioned here today. And like I said, this signature. And in line with the stratification strategy and subnational tailoring by WHO. So we are quite on course on this. Next slide. And then you can see the different tests available. You can keep on hitting enter. You have microscopy that is powered by a human being. And then you have this rapid diagnostic test that is technology. But somehow we refuse to accept technology and we stay with humans with all the challenges. So that's what you see with microscopy. Just keep on pressing enter and all of this. And this is the test 15 minutes. The result is out. The other one will take any time. It will be 1 day. And then based on that, we have done the scoping assessment of facility in Lagos.
Recent times, cosmetic clinics. So we're finding it difficult. We have limited capacity to ensure monitoring of these facilities. We also have inefficient manual processes because our digital platform is unable to carry out some of the processes in the agency. We're sitting on a lot of data in the agency.
With AI to make sure that the test is actually having the results that the pharmacy or PPMD says it does. We then verify that the treatment, the appropriate treatment. And then in the impact program, we to the public health system for malaria-negative patients to ensure that they're getting the proper diagnosis that they need and have a better understanding of what other febrile illnesses patients might have. Next slide, please. Next slide, please. Okay, so I'll just talk briefly about all of the other partners that are working on this as well. So we are working closely, of course, with the Lagos State Ministry of Health, which envisioned this work and brought us in to support on this, with NMEP, which is overseeing the work and providing technical oversight, with WHO, which is providing, again, technical support and facilitation, and then importantly with our private sector partners as well, so PCN, which is doing quite a bit of the regulatory oversight and ensuring the quality of care in a pharmacy setting, with SFH, which is enabling the supply chain, and then of course with LASHMA, which is to go quickly into the final results on why this is improved quality of care. Oh, okay. Sorry about that. So the work is providing network expansion, innovative financing, integrated health systems, supply chain resilience, comparative research, and regulatory reform, leveraging all of these different partners that we've mentioned to ensure that patients are able to access quality care, and that the data is being provided back to Lagos State to help improve regulatory support, policy, and other things. I've mentioned the partners that we have here already, but we're very grateful for all of the work that they are providing to ensure that there's quality of care in the private sector. And then finally, one final slide. To reinforce what Dr. Wellington said earlier, the work that is being done is also to be supporting with testing, understanding the difference between rapid tests and microscopy, to support on policy reform to ensure that rapid tests are always done before treatment for malaria in Lagos State. Thank you all so much, and we're very excited to be a part of this.
Thank you very much, Dr. Jessica Venon, the CEO, by Shebex. Ladies and gentlemen, taking us further, Nina Obulafo. Thank you very much.
Thank you very much, sir. Your Excellency, sir. We're very happy that this is happening today. So just permit me to do something unique in terms of our focus for malaria control in Nigeria. To do this, I will call on Dr. Dao, Hospital Director for Volta. We're going to have the Honorable Minister being tested for malaria. Honorable Minister, please. Thank you very much. This is showcasing the main focus for malaria control in Nigeria, which we refer to as the 3 T's. Your Excellency, the first T stands for tests. We cannot overemphasize or we cannot underscore the importance of that. The second T, sir, is for treatment. Cannot have His Excellency and the Minister of Health standing for long, so once we take their samples, we're going to have them seated again. So can I have Dr. Walter on stage to come and quality check what is happening, sir, please? Thank you very much.
are witnessing leadership by example. Leadership by example by Mr. Governor, Mr. Babajide Olusola Sanwo-Olu, as well as the Honorable Minister of State for Health, Dr. Salako. Please, let's appreciate them. That is the way to go for every one of us all.
Thank you very much, Your Excellencies. So again, this is the way to go for malaria control program in Nigeria. The pre-elimination in Nigeria could commence in phases. We could commence pre-elimination in Nigeria in phases. Thank you, Your Excellencies. Thank you. So back to the fourth bullet on my slide. Your Excellencies, pre-elimination in Nigeria could be commenced in phases. It could start with the states, Lagos State, for example, and we could go geopolitical zones. So I was sitting with my sister, the Commissioner of Health from Ogun State. So the fever for pre-elimination have started. So I also want to say that it stands on Lagos State to make sure that this pathway for pre-elimination is properly done. The National Malaria Elimination Program is waiting to take the experiences and the processes that Lagos will use to achieve elimination to be replicated in other states. Your Excellencies, it's important to note that right now we have a couple of states under 10% prevalence in the country, and those states are Anambra, Kwara, and Rivers State. So what is happening in Lagos that has been flagged off today, it's like NMEP, it's poised to take what these processes and experiences are to states like that. Thank you very much.
Thank you very much, Ma. Let's appreciate her. Thank you very much. Thank you very much. Mr. Governor, sir, Minister of Health and Social Welfare, Professor Mohammed Ali Pati, who has been ably represented here today by the Honorable Minister of State for Health, Dr. Isiaq Adekunle Salako. A round of applause for him, please.
Your Excellency, the excellent Governor of the Center of Excellence, Mr. Babajide Olusola Sanwo-Olu. I must recognize my brother, who is the one who has summoned all of us here today, the Honorable Commissioner for Health for Lagos State. All members of the Lagos State Cabinet here present, our partners, WHO, World Bank, distinguished stakeholders in the health sector, gentlemen of the press. Because of time, let me say all protocols to be extended. We cannot give the governor for malaria alone. He has to attend to water, to road, to several other things. So I will shorten my speech, but I must say that today I'm wearing two caps. You may not see it physically. Standing in for myself and also standing in for my brother, the coordinating minister for health and social welfare, Professor Pati, who is unable to attend because of other assignments. I am most delighted to be at this auspicious occasion of the launch of the pathway to malaria pre-elimination and digitization program in the Center of Excellence, Lagos State, led by His Excellency the Governor, Mr. Babajide Sanwo-Olu. I recall that Lagos State pioneered intensive malaria case management in the early 2000s through the Eco-Free Malaria Initiative, under the leadership of now our President, Dr. Bola Ahmed Tinubu, the Governor. I am most delighted to be here today to be part of another pioneer initiative now under Governor Babajide Sanwo-Olu as Lagos State takes the lead in the agenda to end malaria by 2030. Your Excellency, the Federal Ministry of Health and Social Welfare is elated with this giant stride, which aims to improve malaria diagnosis, case management, and accurate tracking of cases through the integration of digital health solutions in the form of real-time electronic reporting systems, all targeted at further reduction in the burden of malaria and its eventual elimination from our land. This momentous project will not only set a track for malaria elimination in Lagos State, but in Nigeria at large, thereby once again making Lagos State a trailblazer. I want to emphasize that this project is in line with the renewable agenda of President Bola Ahmed Tinubu and the renewed vigor for the Federal Ministry of Health and Social Welfare on the Rethinking Malaria concept that was launched in April 2024 and is aimed at fast-tracking the malaria elimination goal through strategic shifts. We have continued to make progress in this regard, and the inauguration of the advisory on malaria elimination in Nigeria, AMEN, the development of pragmatic, costed plan of action, the expansion of permanent healthcare facilities, training of frontline health workers, and the initiation of domestication of affordable medicine facility for malaria to make malaria treatment more affordable are all testament to the progress we are making. Your Excellency, distinguished ladies and gentlemen, the Ministry is taking these steps in order to reverse the undesirable trend of being the highest burden malaria endemic country globally, accounting for 37% and 31% of cases and deaths respectively. I am confident that the Lagos State possesses the needed attributes that can help drive Nigeria to malaria elimination through such case-setting initiatives like this program. Furthermore, Lagos has been consistently the lowest malaria prevalence state in Nigeria, as evident from all the malaria indicator survey conducted in the country, with the most recent result in 2021 showing 2% prevalence, hence indicating a tendency of attaining pre-elimination when concerted and consolidated efforts are put in place. I wish to report that the challenge of let me use this opportunity to call on all stakeholders not to relent on their support towards this impactful intervention, which will contribute significantly to the drive at eliminating malaria from the world. Nigeria is ever committed to this drive and we will continue to toe the path of global best practices. I wish to assure all Nigerians and our partners that the change in the policy of the United States government with respect to global health funding will not adversely affect our malaria elimination programs and other public health initiatives, as President Bola Ahmed Tinubu GCFR has approved a robust mechanism to ensure adequate and cost-effective funding for public health programs. I call on all state governments to join hands with the federal government to ensure that our country becomes self-sustaining in the funding of our public health programs. Before I end this address, let me commend once again and appreciate His Excellency, the Governor of Lagos State, Mr. Babajide Sanwo-Olu, and his health team, led by Professor Akin Abayomi, for initiating and executing this laudable innovative project. I wish to also sincerely appreciate all the partners, World Bank, WHO, all the implementers, especially for providing the needed human resources, technical support, and the funding for the implementation of this initiative. I wish all of us a successful launch of this impactful project as a springboard for the elimination of malaria from our country. Thank you, and God bless the federal government.
Distinguished invited guests, Your Excellencies, Honorable Minister of State, have your results. I'm pleased to say that confining you in a bed in Lagos, your result is negative. Indeed, when patients go to clinics and the doctors tell you that they've performed the test, it is your responsibility as a patient to see the test. Please ask for the test and take a picture of it and have a record on your phone. My governor, the Excellency of Lagos State, I'm pleased to tell you that you may continue with your duties.
Congratulations, sir.
Your test is negative, and the low prevalence of malaria in Lagos has been charted course to pre-elimination. Thank you very much for your support, both the Honorable Minister and our Governor and members of the Lagos State Executive Council. Mr. Governor, if you would like to approach the podium to give your keynote and to launch a pathway to malaria elimination in Lagos.
A practitioner himself and a strong politician, Dr. Souq. Thank you very much for finding out. Members of the Executive Council, especially Professor Akin Abayomi, and Special Advisor on Health. Thank you very much. Other cabinet members, all the permanent secretaries in the Health Ministry, and several of you that are here. Thank you very much for taking our time. The Country Director for the World Bank, Dr. Diop, the Country Representative for the WHO, Dr. Walter, all of our partners that are here, MyShamed, Impact, SFH, the National Malaria Organization, our friends from our neighboring state, the Honorable Commissioner for Health in Ogun State, thank you. All of our health practitioners and stakeholders that are here, gentlemen of the press, ladies and gentlemen. When you are asked to come forward and conduct a test that you did not psych yourself for, what will happen is you quickly your brain will raise back and say, have I been feeling unwell? What is going to happen? It just brought us back 5 years during COVID, and they said that they're going to do a COVID test. It was like, the heart was going to open and you don't know what will be the outcome. But you see, it's an important activity that we need to continue to subject ourselves to. You might think it's a simple thing, but it's so important. And that ability for you to come forward, if it has turned positive, what it will have just meant is that we need to make a treatment. It's not a death penalty, but it's really just for all of us to know that we need to do this thing and we need to be able to come forward transparently at all times and let us end all of these things that we don't want again in our sight. Thank you very much. And so it's an honor that I stand before all of you in this room are very strategic to launch the first in the country, another Lagos first, the pathway to malaria pre-elimination and digitalization program. We're here to affirm our commitment to safeguarding lives and the livelihood of every Lagosian. Malaria is more than a disease. It's a social-economic burden that has held back individuals, it has held back families and communities for such a long time. It robs us of our productivity, it drains us of our household incomes. And for many households in Lagos, especially those modest earners, malaria, the name it alone brings shivers. It reduces their earning and reduces their ability to continue to earn more for their family. And so this financial strain often affects families and a lot of times causes heartbreaks and the rest of it. But we're here to put a stop or to even bring a voice to the step at which we want to eliminate that completely. It has affected school children from going to school, it has affected businesses, It has seen a whole lot of absenteeism and a lot of challenges in our society for several decades. But today, we had to change all of that narrative. The eradication of malaria is not just a good health news. It is indeed an economic imperative. It's a good news that all of us must beat our chest and be able to carry, if there's a P, that we need to have, a pre-elimination, the campaign for it, we need to have it, and we need to be able to dot it everywhere. We know from statistics how much malaria has cost our GDP, billions and billions of dollars. Imagine what Lagos could achieve with a lot of resources if we're able to eliminate all of this. We no longer have to choose between survival and opportunity. Imagine a Lagos where every child can attend school uninterrupted because of ill health, or an adult can contribute fully to the economy. And one thing that is instructive was the demonstration of the slide by Professor Campbell, and I saw others as well. I can see that Prof already has a side job in animation and cartooning. It's a job that he can conveniently retire into. And the narratives were very clear. But the message was very, very transparently done. And all of us, in one form or the other, are guilty of this. You feel unwell, you think you have a fever, the next thing is you are diagnosing yourself with malaria. Very easy. Just give me injection. Just give me this tablet. I know what it is. We are all, self-diagnosing ourselves and self-telling ourselves that is what it can only be and that is what it is. So just give us. But we can see that with knowledge and with communication, a lot of all of those negative things, you can rewrite them. And so this program represents a hope rooted on innovation, collaboration, and determination by leveraging digital tools that will ensure that every malaria case is tracked in real time. This is digital. Long are those days when you need to take a whole full blood from your body to just do a simple malaria test. I was asking for my bottle of Martina, because those days when they take your blood test, you must replenish it with a bottle of Martina. But you can see that with just a small prick, and in no time you can actually, that's what digital life, has done. And so it has helped us by strengthening partnership with the private sector. We will expand access for quality care. It will help communities to have the knowledge and resource. It will build a culture of preventing that leaves no one behind. And that's a message we need to come out of from here. All of us sitting in this room must immediately turn ourselves into an advocate, into a cheerleader, to be able to carry this message forward, to be able to tell everybody that needs to know. Go into our communities, pass on this message that this pre-elimination launch program has started, and it's for all of us to see it, to buy into it, and to work with it. The benefit of eradicating malaria goes beyond just health. The malaria-free Lagos, and indeed in future, the malaria-free Nigeria is achievable in our time. And we've all put our minds to it, it's something that could be done. We believe that if we can eliminate it, it will increase productivity, it will improve educational outcomes from our children, it will reduce considerably our health costs. It would also enhance quality of life. All of these points speaks to a better livability standards, in all indices. And so this vision, though ambitious, I believe is achievable. It requires, therefore, all of us, government agencies, healthcare practitioners, healthcare providers, community leaders, development partners, and indeed all citizens to work together with an unwavering resolve. Success will not come overnight, but will be sustained effort and collaborative action. We will prevail. You saw the slides that a farmer and the lady on malaria and the lady on immunization. You saw the statistics between January and February, what the run rate should be. Yes, we could say that, this is just March, but we need to be able to double those numbers. We need to push those numbers to be able to achieve the 2025 target. We need to be able to push push and achieve, because there's no magic to it. If your target is 2 million and at the end of February we are still doing less than 200,000, you are doing far less. So you need to double, your spike shoots. You need to work harder, twice as fast, twice as much for you to achieve the 2025 record. And Doctor told us, Prof told us from WHO that it's 2025. They are going to close the envelope. Hello? Yes, they said they are going to close it. And there's a 20. Where is it? I thought it was. They're going to close it. Our target is that we have to take that $20 million. We have to do everything to make sure that we'll meet the criteria very quickly. Because if it's something that we all say we want to do, then everybody must be on the same page. I want to commend the farmers and all the ladies that came forward transparently to show us those data. And what we need to do is we don't need to wait in October before we now cry. We need to be able to track this thing on a month-on-month, basis. So I want to thank all of you. I want to thank our partners, the World Health Organization, the World Bank, the National Malaria Elimination Program. Our community pharmacists are here. All of our pharmaceutical associations are here. Thank you very much. Our various private and public hospitals, and all of you that are here for your valuable support and making this initiative positive. Of course, permit me to thank in absentia our very hardworking Honorable Minister of Health and Social Welfare, Professor Mohammed Al-Pate. Our best regards and best wishes to him. We know all of the things that he has brought about in his tenure as the Honorable Minister of Health. We wish him well. We are also tracking and monitoring, all of his deliverables so that we can say at the end of the day, in your time, you did all of this. And to also thank the Honorable Minister of State for cooperating and operations with the Honorable Minister. We believe that if you do all of these things and you do them well, your time, your time in that ministry will be written in gold, and Nigerians will forever be grateful, because we know that you are pushing everything to ensure that we save over 1 million lives, and you're doing so many things, so many big health initiatives. I want to wish you well. To Dr. Diop, our country director for the World Bank, thank you for your invaluable support at all times, funding your technical assistance. We believe it will continue to catalyze our health initiative. To our country director on the Bill and Melinda Gates Foundation, Mr. Uche, whose organization's investment has been pivotal to malaria control. We say a big thank you. Dr. Walter, our WHO country representative, we believe that your expertise and advocacy capacity has helped us to push this forward. Thank you very much. To all of our partners, Marshall Mets, who I met last week, I did promise, I said I'll be here in person. And to all of our other partners, please, let's see this as a start to work. It's only when we achieve what we have said for ourselves that we have done the job. They don't pay people for attempts, they pay people for results. And it's the result that is important. It's the result that takes us to that final breaking point in which we all can say that yes, we've done our best, we've contributed what we needed, and we've seen the results. I believe that we have everything to make it work. We believe we have all it takes to eliminate malaria completely in Lagos State. I want to congratulate our own Ministry of Health. Congratulating ourselves is telling you that you have a lot more to do, Prof, and all of you. But I will be watching, and I will do everything to continue to encourage you. And as a demonstration of that encouragement, I was whispering to Prof that I will also do something different. I will be promoting Dr. Idu as a permanent secretary. Twice as much. All the very hard work you're doing. To my fellow Lagosians, fight belongs to each of us. Let us embrace a preventive measure like eliminating mosquitoes, adapt, test before treatment. pharmaceutical establishment. Ensure that we can pass this message. Test before treatment. It is so important that we do not just take this for granted. Let us ensure that we can take this advocacy into our communities, into our nooks and crannies, and show truly that once we have started this campaign in Lagos, it will go around every part of the city. We can rewrite the history of malaria in Lagos, and it is in our hand. It's all of us in this room that can help. I want to wish you all the very best, and I believe that when we work together, there's absolutely nothing that we cannot achieve together. Thank you very much.
Mr. Governor, sir, may I plead your indulgence, Councillor President?
When we were doing interview, she thought I really didn't like her. She was frowning her face one day. It was between her eye and her eye. This pre-examination launch of malaria from Lagos State. Pathway to malaria pre-admission and sterilization program in Lagos. Thank you very much. Thank you.
Mr. Governor, sir, may I crave your indulgence to quickly invite this Honorable Commissioner for Health, Special Advisor on Health and Permanent Secretary, Ministry of Health, to join you for the first photo op.
Also, we are inviting all the permanent secretaries in Lagos State to join the executive governor, actors from the Federal Ministry of Health, all the directors that have accompanied the Minister of State for Health, all the directors in the Federal Ministry.
My name is Muiba Wonu Folami, an indigenous of Lagos State, Ikorodu, to be specific. I was born in Lagos 86 years ago, and to the glory of God, I'm still alive and well, and trying to be a relative in the cause of women. I attended primary school. I started at Ansarudin Alakuru School. From there to CMS Girls School, and then Queen's College, Lagos. From Queen's College, I went to the Portsmouth College of Technology for my A-levels, and then University of London for my first degree in law. The same university for my master's degree in law. I had, between obtaining my master's and my first degree, I was in Nigeria to do the mandatory law school course. I was one of the last people to do a 3-month course before it was changed to 1 year. And then went back to England for my master's. And from there to lecture at the University of Zambia. Back to Nigeria, I was appointed by Dr. Taslim Elias, the CJ of Nigeria, to the Commission for Advance Notice to Lawyers of Developments in Law. It was a commission funded by the Ford Foundation to keep lawyers abreast of the developments in law. I was a director there. Then from there, I was admitted to the Federal Ministry of Justice. After being legal advisor to many ministries, I ended up as the Director of Public Prosecutions for the Federation. And after that, whilst I was the Director of DPP, I was appointed Attorney General and Commissioner for Justice in Lagos State. After retirement, I've been involved in social work, in religion. I've always had religion, but I spend more time on religion. I read, I watch telly, and I live a good life, to the glory of God. You see, when you begin to think that it was not until 2007 that women started to get equal pay in tennis tournaments. And it was something that was fought for. Little things like that does not add to equality. But when it was done, it may be small, but at work, even at work in employment, women are still discriminated against. And most women do 2 jobs. They look after the home, and they do the normal work that a man does in an office. Why I fail to understand this inequality in the treatment of women is that the work, the responsibilities in the workplace is not reduced for women, even though we do not want to be paid the same salary as men. It's a fight that has continued, and in that area, I think we need to do more to push for more recognition. Women have contributed immensely to the society. The men that are now resisting equal pay were brought up by women. That's what I do not understand, that they can think like that. We continue to push.
But how can we speed this up?
By bringing it to the attention of world powers, recognition by every country of equal opportunities, equal pay. I want to know, I want somebody to explain to me the jobs that women cannot do.
Yeah.
They've contributed immensely. Even in the new thing, IT, we're at par with men. So I do not see the reason for it. Unfortunately, I did not experience it, because when I left university, I practiced law briefly in my uncle's chambers before I went to University of Zambia as a lecturer. There, my position was enhanced in the sense that I was a foreigner and I got all the benefits of being a foreigner, serving in their service. Fortunately, in Nigeria today, the federal government does not discriminate in terms of salaries. Whether you're a man or a woman, you get the same salary scale. And you are promoted on equal basis. Kudos to the federal government, to Nigeria for that. But in the private sector, things are different. In some companies, this is the areas that we have to work on, because the job content is the same. Some of these facilities are available in Nigeria. I learned by being a member of the Society for the Disabled that every government body must admit a certain percentage of women and of disabled people. Most times this opportunity is not taken. They are bound to employ them. We continue to push for that to be implemented in most ministries. It's important because it's there. You have to take a certain percentage of disabled people to work in government positions. It's important that we work to enforce that rule in our society. When it comes to discrimination, Nigeria is way ahead of some developed countries, because we, through slavery, we faced discrimination right from the beginning. We now know how to resist it. But in my country, Nigeria, in the federal government, in the state government, there is no discrimination. It may happen in private organizations, but they must continue to push to let them understand that the job content is the same. Well, you see, traditionally, under our culture, women are in the other room. Well, the quotation.
Yeah.
That's our society. That's our culture. it's going to take a long time to evolve. In my time, female education was not so-called popular. It's only the educated few that strove to send their children to school, their girl child to school. They end up trading with their mothers or going to market and getting married off early. But as education began to rise in our community, its value was seen by my parents and others of their contemporaries to educate the girl child. And I believe the society is benefiting from that. So we must continue to push for the education of women, of girls. I have fought that, when I read that, the certain state government has appointed look at our National Assembly, 4 women in the Senate. Isn't that shameful? And that is the society. We have to continue to push women up. Let these political parties know that we want women. Let us organize ourselves to continue to vote for women massively. I give kudos to our governor, Babajide Sanwo-Olu. His cabinet women is well represented in his cabinet. And I enjoy that, I love him for that. And I continue to urge him to do more. He's done a lot. I think Lagos State has the largest representative of women in cabinet. First of all, they have to project themselves in their office space, their workspace. Let everybody know that they are equal to the task. Let us organize. There's a lot of society groups and societies that cater for the interests of women. I believe now violence against women is reducing in the society because there are sanctions for such behavior. I must say that speaking to the organization in charge of violence against women, I was amused to learn that some men come there to complain and that they are also being violated and abused.
Yes, it's a two-way
thing. So that is reducing our society. Education of the girl child is important. We have to let the newcomers know that education is important. Let them showcase to them the lives of those who have been educated and who are holding high positions. I'm glad that our president, Bola Ahmed Tinubu, has returned history to the classrooms. It's important. Let them know about people that have contributed to the development of our societies and country. It's important. Yes, it's education. It's education. Once people are educated and they know that there is nothing a man can do that a woman cannot do when it comes to the workplace. We have women engineers, miners, and also all over. Give me a job specific. that a woman cannot do. Then I'll change my views. So the moment you begin to upgrade education, let government now continue to vote more for education. I don't believe we are doing enough. There is a UN convention, and I think Nigeria is part of that convention, that a certain amount of a nation's income should be devoted to education. I'm not sure whether Nigeria is complying with that. But some states are better than others. And we must, education, I believe in education of the girl child. Some states now are taking children, girls off the street. Walking is completely prohibited. Things like that will help. Unfortunately, in Nigeria, we are not advanced enough to use our votes to change things. We are still not voting for individuals. We are voting for party, irrespective of performance. Education will help. And when we join other nations for the same purpose, we get results. Our organizations who are fighting for women in Nigeria should join worldwide organizations to showcase our own situation and learn. I believe that when you talk to others, you come back with ideas on how to improve things. So we must improve things by telling women in positions to show, to continue to prove that they are more than up to the task. It will not come to us on a platter of gold. We must show by our actions and behavior that we are up to the task. Of course, some women are wrong in claiming equal rights to their husbands in the house. I completely abhor that behavior. Even though they are husband and wife, the man in my culture remains the head. You should be respected. His views should be respected. It's only now the condition of living is so high that you join the two incomes together to run the house. In the past, it was the men that ran the house to pay for everything. Maybe some of these women are thinking that because they are contributing a quota to the development, that they have equal rights. Yes, they have equal rights on the upbringing of the children in their homes and everything. But respect is important. That will keep the home, and the children will learn and imbibe it into their own children too. Equal right does not, in my view, mean that you can be rude, can not submit to your husband's wishes. Equal right means something differently. Respect comes out of it. It's important. I go out and I'm like appalled at the way women dress. There's a competition to show as much of your body, to produce as much of your body that you can. It's absolutely disgusting. They're not women. They're no longer women. the exposure, things that if you did in my time, a member of the community will cover you with a cloth and send you home. Because community mattered at that time. You dare not misbehave outside your compound because this community is watching you and reprimanding you if you go wrong, if you behave badly outside. That is law. And that is why you see people, even their dressing, show disrespect to womanhood and to themselves and to the community. We must learn, teach our children etiquette of dressing, speech, how to think and speak in a decent manner. We don't have it anymore. We're losing it, and it's shameful because people are appreciating naked women on the streets.
Yeah.
Both sides. If people dress badly and you tell them and ignore them, they won't try the next time. For instance, I believe nobody can dress to come to my house or to come to my party like a naked woman. I will turn her back. I will turn her back. So that's the type of thing that we should all do. Let the people doing this know that we do not appreciate things like this. When the society itself corrects it, we must correct it individually. If their parents cannot correct it, we must, by ignoring them and not allowing them to come near us. Show our women that have contributed to the society.
Yeah.
Show them, showcase them, showcase them.
Yeah.
We have the first woman senior advocate of Nigeria. We have Okonjo Iweala. We have, in the UN. We have all sorts. We have what's this pharmaceutical woman? She's done so much. The younger ones are there. Little ones like Shadi Okoya is managing her husband's company and doing well. Let's encourage them. They are young. The young ones, they are working to improve the society. There's so many of them out there. We should showcase them. Let them know that we have women who are of top quality, intelligent, and well-behaved, and they dress well. Dressing well is dressing in a manner that is appealing to the eyes, not nakedness. That's my darling, this new CJN of Nigeria.
Okay.
Who do that? I did talk about Kekele. I mean, we're there. Female CJN.
Yeah.
And there are so many female chief judges all over the Federation. There are so many in the medical profession, in the engineering profession. We have pilots. So let them know that there is nothing that a woman cannot do. In IT, in everything, women are moving forward. We should showcase them. We should let their pictures be seen in our newspapers, in our news, in everything, to encourage young girls that you too can get there. If they don't see, and if they don't know the history of these women, how they got there, they too will not be inspired. We have to inspire the young people with the achievements of women achievers. Kekere rose from magistrate to right to the top. I admire her. She's well composed, well behaved. Some of these people, when they become something, they lose their heads. They start to, no, she's so respectful, well-behaved, well-dressed. I don't think she would allow herself or her children to come out naked. Never. So people like that, Okonjo-Iweala are the same. We have a lot.